deal, Mr. Speaker. It is a good news day for Canadians.
Canada breathes a collective sigh of relief as the COVID-19 vaccine is approved.
The latest agreement is bringing vaccines to Canadians earlier than we hoped.
But who's first? Health officials start to detail the distribution.
Where you live, you go up there and you stay there. You don't be leaving your place.
Here in Ontario, numbers continue to climb. Are even tighter restrictions next? Humber News starts now. Hello, I'm Melanie Valente-Leite coming to you with a virtual newscast for Humber College. It's Friday, December 11th, and this week our focus is all on COVID. Here's what's making news. It's a historic week here in Canada. Finally, some good news. After a year of unprecedented pressure that has had populations worldwide battling a global pandemic.
At last, we have a reason to feel optimistic and excited about returning to the lives we led pre-COVID. The latest agreement is bringing vaccines to Canadians earlier than we hoped. Things are happening quickly.
The Government of Canada is now preparing the first 30,000 vaccinations, which are set to be delivered countrywide as early as Tuesday. They plan on distributing almost 500,000 doses, and the remainder are expected to come before the new year. The Prime Minister reminds Canadians to remain patient until things can start to get better.
But we are not through this yet. We've got a tough winter to get through, and I know we're going to be able to get through it together.
The vaccine is set to be shipped from Belgium to 14 predetermined locations here in Canada. And because of the volatility of the dose, those who are first to receive the shots must travel to those arranged sites. Canada is the third country in the world after Britain and Bahrain to accept a suitable candidate. With an approval for the vaccination, Canada health officials and government agencies announce who will be the first to receive the vaccination. The National Advisory Committee on Immunization says the first vaccines will be distributed to long-term healthcare workers, caregivers, essential frontline responders, followed by Indigenous communities.
This is a critical milestone in our fight against COVID-19 and in our efforts to provide every Canadian with access to a vaccine. Canadians can have confidence in our rigorous review process and that the vaccine was authorized only after a thorough assessment of the evidence demonstrated that it met Health Canada's strict standards for safety, efficacy, and quality.
Ontario's Premier confirmed that Toronto and Ottawa would get the country's first doses next Tuesday. Health Canada's Chief Medical Advisor explains that only people over the age of 16 are able to receive the vaccination. This is due to Pfizer's lack of data on how the injection would affect the younger Canadians. The vaccination can't come fast enough for Ontario's hardest hit regions. This week, hospitals in the province say they are reaching a critical point in COVID admissions.
It may make your eyes water, cough, or gag. If you can't handle it, you can put your hand up and I'll stop.
New cases have pushed the 7-day average of daily cases to 1,820, the highest it has been at any point during the pandemic. COVID-19 hospitalizations continue to climb in the province, and the number of patients has surpassed 800 earlier this week. Toronto and the Peel region are in the grey lockdown area category, while York region remains in the red zone. A lockdown may be inevitable because of the spike in hospital admissions in York region. Medical officer of health in York region is advising those from lockdown zones not to move from one zone to another.
When it comes to people coming to York region from the lockdown zones, the province generally advises them not to move from one zone to another. We in York region have incidence rates that are similar to those of Toronto's, although Peel's incidence rates are higher. Therefore, we have taken the position that whilst people are supposed to stay home and only come out for essential shopping, if they do come here, we want to make sure that everybody is kept safe.
Residents are looking to Premier Doug Ford for answers, but earlier this week he has announced that he will no longer be holding his daily COVID-19 briefings. However, Ford will continue to make his number one priority that all residents of Ontario will receive a COVID-19 vaccine.
Ontario is ready to do their part, and we'll be ready, as we are now, to receive and distribute the first batch of vaccines when they arrive on our doorstep.
And with Christmas Day just 2 weeks away, provincial officials across the country have urged Canadians to reconsider getting together for the holiday season. With cases only continuing to increase in the province, teachers are speaking out about the concerns they have, especially with the holiday break approaching. This week, 2 more schools in East York announced COVID outbreaks. Thorncliffe Public Primary School reported 19 positive cases, and Marc-Gagnon Collegiate Institute, a secondary school, reported 14. The cases were reported after the government began a pilot project for voluntary testing that officials began last week in some schools. The result of the testing has brought some concerns for teachers and parents. However, results of the testing might get worse given that people will gather over the holidays. In an open letter this week, teachers are asking for the testing to be conducted in all schools and a 2-week extension after the break.
One of the things that we would like to see is this considered and announced as soon as possible so that teachers and education workers know what they're facing when they return to work, and so that parents have an opportunity as well to put plans in place should they need to.
Toronto Stop Doctors says the evidence points to community transmission and not in school.
Is there evidence of transmission within the context of the school?
But the head of the teacher union is also urging the Ford government to provide adequate funding to ensure a safer start to the new year, and that teachers should be considered as frontline workers. Over in Quebec, officials are taking it a step further in trying to persuade people in following the COVID-19 safety regulations put in place.
Alert issued by Quebec, alert ready in force for all of Quebec.
The province used its emergency system to alert the public on Wednesday, reminding them to social distance. Premier François Legault has taken COVID-19 punishments to another level because of growing frustrations.
You cannot have guests, no gatherings. The only people that must be at home are the ones staying in this home. So if you see 5 or 10 cars in front of a house, it means that they don't respect the measures.
The police have been issued to find Quebecers caught breaking social distancing laws. With these warnings put in place, lawbreakers can be fined anywhere between $1,500 to $6,000. Businesses that are able to close from December 17th to January 4th are urged to do so. Quebec is waiting to receive its first batch of the Pfizer vaccine early next week, and more than 500,000 Quebecers could be vaccinated by the end of March. Out west, Alberta has put forward increasingly tougher measures to combat COVID-19 after a recent rise in cases.
It's been a tough year for all of the Albertans who have been touched by the COVID pandemic. And most of all, for those who in our province have lost loved ones.
Alberta has seen a recent spike in the numbers with 1,566 new cases and 13 more deaths on Thursday. In a recent press conference, Premier Jason Kenney announced that social gatherings of any kind will be prohibited and masks are now mandatory in all indoor environments. Beginning Sunday, recreational establishments will close their doors and the public will be working remotely from their homes. Although, restaurants have been permitted to stay open for takeout and delivery.
Remember, the goal is to bend the curve, not the rules. This is a challenging virus. While COVID-19 cases can accelerate very fast, they decelerate more slowly.
The province looks to become the next recipients of the Pfizer vaccine. And in an effort to aid frontline medical workers, Alberta has announced almost 4,000 doses of the vaccine, which will be administered to them by next week, Wednesday.
These staff are exhausted and they've put themselves at risk for 10 months. They need support and they need to know we're there for them. And I hope that seeing the immunizations begin will show them that there's light at the end of the tunnel.
The news about the vaccine has everyone wondering what's next. The same goes for Prime Minister Justin Trudeau, who held the First Minister's meeting to discuss healthcare funding and vaccine distribution with Canada's premiers. The province leaders unanimously decided that the $42 billion they are set to receive from the federal government isn't enough help to respond to COVID-19. Currently, there are over 400,000 confirmed cases with over 13,000 deaths as a result of the virus. The provinces are looking to receive an additional $28 billion to their annual health transfer payment. And although Trudeau agreed to meet with premiers to discuss their demands, he has made it clear that surviving the pandemic is his top priority. The Prime Minister scheduled the first half of the meeting to talk about the distributions of vaccines throughout the provinces with hopes of a brighter future for Canada. And as the rest of the world waits patiently for the vaccine, the United Kingdom has become the first country to start administering the Pfizer vaccine. 90-year-old Margaret Keenan was at the front of the line. As the historic rollout began, UK health officials discovered some cases of allergic reactions to the vaccine. Health officials have confirmed their recovery, but the type of reaction that occurred is unknown. The UK is now warning people with significant history of allergies to avoid getting the vaccine just yet. With Canada's plans to start next week, health officials here are watching closely.
When we do an authorization, it means that we've looked at it and the benefits outweigh the potential risks. But it is still a drug, it's still a vaccine, and there are potential risks even if they're rare. So that's why it's important that we continue to monitor it.
Despite concerns about Canada's quick approval, health officials are moving forward with the vaccine, saying recipients should not be fearful. The UK receiving the vaccination may be good news for many, but government organizations are raising concerns. Although certain countries are waiting to receive the vaccine, some are worried that they are being deprived. Oxfam, a member of People's Vaccine Alliance, is worried about equal distribution of the vaccine around the globe.
You know, countries like Brazil and India, seeing some of the highest numbers of deaths across the planet in those countries, more lives will be lost from COVID if we don't get a vaccine.
The World Health Organization created a global vaccine program called COVAX, which is supposed to ensure equal distribution of the vaccine. Even though COVAX hopes to deliver 2 billion doses by the end of 2021, that covers only 20% of the population in some countries.
We don't have enough supply of the vaccine, not enough is being made. And the second problem is that rich countries have already advance purchased the vast majority of those ones that are promised for next year.
Oxfam urges others to support the proposal made by South Africa and India to waive intellectual property rights for COVID-19 vaccines, tests, and treatments. As the world takes a positive step towards the end of the pandemic, one Montreal-based artist honors those who were impacted the most by the virus. Raphael Locenzo Hemmer is known for his immersive technology-driven art, but his latest project is inspired by his experience with the pandemic. He contracted the virus back in April and has now recovered. Hemmer uses his art to shed light on the faces that have been lost to COVID. His virtual art installation, A Crack in the Hourglass, creates portraits of COVID-19 victims using sand in real time on his website. The automated machine slowly dispenses sand, creating the portrait in just 30 minutes. Once each portrait is complete, the board holding the sand tips forward, dissolving the image. The sand is then reused for each new portrait in. Hemmer says the title, A Crack in the Hourglass, refers to the distorted time we're living in. And for many, distancing restrictions have changed or even eliminated funeral practices. But Hemmer hopes this will help families pay homage to their loved ones. The installation started last month, and he has completed 153 portraits since. For those looking to participate, you can upload a photo of a loved one and a short bio to the website, acrackinthehourglass.net. That's all for today. I'm Melanie Valente-Leite. Humber News is written and produced by students in the journalism program. For more coverage, visit our website, humbernews.ca, and follow us on Twitter at HumberJRNL. We'll see you again next time.